Good afternoon, everybody, and welcome to today's webinar on health in the context of global climate change. My name is John Balbus, and I'm the Senior Advisor for Public Health at the National Institute of Environmental Health Sciences. And in my role as co-chair of the Institute of Medicine Global Environmental Health and Sustainable Development Innovation Collaborative, which is sponsoring today's webinar, I'd like to welcome everybody on the phone and in the room here to the second of our 3 webinars in our series this summer. You can see on the screen the date of our next webinar. It's July 25th, and we look forward to your participation in that webinar and all of these discussions as we consider health in the context of global climate change and health in the context of global environmental health and sustainable development. Today's webinar is a special webinar. We are going to be discussing the topic of scenario development for predicting future health effects of climate change. And this is a topic that, even though it sounds like it's just about climate change and the health implications of climate change, really is one that involves the entire global health community. And for that reason, it's great that we're able to have this webinar with the entire PAHO community. In order to understand how climate change will impact health in the future, we have to understand, first of all, the ways in which climate change and climate variability and weather affect health in the present and project how those impacts will be felt. And part of that is understanding, since climate change acts as a force multiplier or as an additional stressor on top of existing stressors for a population, part of it is understanding what the future world will look like in terms of the incidence and prevalence of those kinds of conditions that convey vulnerability to climate change health impacts. There's an effort going on now in the scientific community as part of the international efforts to understand the impacts of climate change broadly and the health impacts of climate change more specifically, to improve the models that we use for this. And in order to do that, we have to be able to produce rigorous and credible scenarios of the future to support these predictive efforts and support these models. And so that is our topic for today, and we have an excellent lineup of speakers with us here in order to help us understand the issues involved and to help educate the community about this process. As I mentioned, the webinar is the second in a 3-part series coordinated by the Institute of Medicine's Roundtable on Environmental Health Sciences, Research, and Medicine. And as we get started, we just want to acknowledge my employer, the National Institute of Environmental Health Sciences, and our site here, the Pan American Health Organization, for their roles in supporting today's event. So our first speaker today is Dr. Kristie Ebi. Dr. Ebi is an independent consultant and a consulting professor in the Department of Medicine at Stanford University who conducts research on the impacts of and adaptation to climate change, including extreme events, thermal stress, foodborne safety and security, and vector-borne diseases. Dr. Ebi was recently the executive director of the IPCC's Working Group 2 Technical Support Unit. That's the group that works on impacts of climate change from 2009 to 2012. And she's worked extensively with the World Health Organization, the UN Development Program, USAID, and many others on assessing vulnerability and helping to implement adaptation measures around the world, including Central America, Europe, Africa, Asia, and the Pacific. Dr. Ebi has a master's degree in toxicology and a Ph.D. and master's degree in public health in epidemiology, as well as 2 years of postgraduate research at the London School of Hygiene and Tropical Medicine. Dr. Ebi, we're glad to have you, and you're ready for you to start.
Well, thank you very much, John, and I want to thank everyone who's joining the call today. As John mentioned, I want to talk about what is going on in the development of new scenarios. It is being designed for the climate change community. As John said, it's very important, actually, for all of the global health community. I'm going to talk a little bit about the history so everyone understands where this work is coming from, and then talk about the developments where we are, and hand this off then to the other speakers who will fill in some details and talk about where we're going in the future. Scenarios have a long history in climate change. Most of the work has come out of the integrated assessment modeling community. They're the community that's asked questions by policymakers of what will particular mitigation policies cost. And so you can see on this slide that the first scenarios were put together in 1984. So we've got almost 30 years of work on scenarios. It was put together by Jay Edmonds and John Riley, and it was for the U.S. Department of Energy. This led to the first IPCC scenarios that came out in 1990, and then the second set, which came out in 1992. For anybody who's been involved in climate change for a while, you'll recognize on the right-hand side the first set of scenarios that were really used in the impacts community were cleverly termed IS-92, and then it was A, B, C, D, E, and F, where IS-92A was considered business as usual. These were used in the IPCC report. The governments came back, though, and said, what's the storyline behind these? Did you just pull these numbers out of the air? How did you determine how emissions would trend over a century? I'm going to make this go forward. And so this led to the special report on emission scenarios, a very large process that was led by the IPCC. The way this was developed is there was a couple hundred people involved in this, and they first developed visions of what the future might look like. These are internally consistent visions of the future, focusing on socioeconomic variables. The primary focus was on population, how many people will be in the world, where they're going to live, what technologies they're going to use, how wealthy they're going to be, and those variables will tell you then something about emissions in the future. So once you worked out these socioeconomic variables, from that you determined the emission of greenhouse gases. The primary focus was on carbon dioxide. Once you have the emissions, you can work out the concentrations in the atmosphere. All of that is then put into the Earth system models, and projections are made on what will happen with global surface mean temperature. A very logical linear process. In developing the special report on emission scenarios, anyone who works on scenarios will tell you you develop 4. If you have an odd number, there's always 1 in the middle. So they developed 4. And you can see in the lower left-hand corner, they were developed along 2 axes. One is whether the world was more focused on economic issues versus environmental issues, and the other axis on whether the world was more focused on global or on regional issues. The governments did not want one of these scenarios to be more privileged than another, and felt it would be therefore appropriate to not give them names, which is why we have A1, A2, B1, and B2. And an A1 world is a world that is more focused globally, so you've got strong international institutions, and it's more focused on economic issues. It's a world with high emissions of greenhouse gases. The B2 world is a world that's more focused regionally and environmentally. You've got weaker international institutions, but there's much more focus on more issues along the lines of sustainable development, and you've got a lot lower emissions. These have been extensively used by the climate change community to project what is likely to happen as temperatures increase and precipitation patterns change. These came out more than a decade ago, and there's been a lot of changes in the last decade, and I'll just run through a few of these. This is a nice summary of what now goes into the Earth system models that talk about how climate will evolve in the future. The models that were used for the special report on emission scenarios were much simpler models. The new models have the full basket of greenhouse gases in them, so it's a big advance to have more than just CO2 in the model. They've got aerosols in them. There's much more on terms of ecosystems and how ecosystems feed back to the carbon cycle. So big advances in understanding from that part of the equation. From another part of the equation, the integrated assessment models have also advanced considerably since the special report on emission scenarios, and they've become much more complicated. They include a lot more human and natural Earth systems within their models. They're much more complex descriptions of how the future could evolve. Other factors that I don't have slides for, one of the big ones is that the population projections that were used in the special report on emission scenarios were from the mid-90s, which means that as fertility has fallen around the world, the estimates of population in the special report on emission scenarios are completely inconsistent with where we are and where we're projected to be. There's also been understanding growing in other areas as well, technology change. At the end of the process of developing the special report on emission scenarios, there was a joint decision by the world governments and the scientific community that the scientific community would lead the next process, that the IPCC would not lead the new scenario development. And that's very important to keep in mind. Because the scientific community is in charge, it means, in essence, nobody is in charge. And so one of the things that happened was that there's been a delay in this process. There was finally a series of discussions between the integrated assessment modeling community and the climate modelers to talk about what they would like to do for the new set of scenarios. Because there was a delay, it was decided that instead of following the kind of process that was followed for the special report on emission scenarios, that in fact the first decision would be around the concentrations in the atmosphere in 2100. There would be an agreement between the integrated assessment modeling community, the climate modelers, on those concentrations. They had three criteria. One is that they wanted to span a broader range of emissions than were used in the special report on emission scenarios. The second was that the climate modelers could distinguish those concentrations in their models. And the third was an integrated assessment model had to more or less reach that endpoint. You don't need to understand those details, but you do need to know there were specific criteria that were used to choose them. It was decided to have four. They're called representative concentration pathways, or RCPs. They're representative because they're representative of the full range of possible emissions over the coming century. As I said, there's four of them. Because these have the full basket of greenhouse gases in them, you've got both short-term and long-term forcing from methane, from CO2. They are in what is called radiative forcing. It's in watts per meter squared. And it just tells you how much the greenhouse gases in 2100 will be pushing the climate to change, basically. The lowest is RCP 2.6. I'll show you more about this. It's what's called a peak and decline, where emissions will go up for another decade or so, will decline, and will in fact have negative emissions by 2100. And I've got the text up there that this is in end about a 450 ppm CO2 equivalent world in 2100. RCP 4.5 is stabilization. It's not a peak and decline. It's about a 650 world. 6.0 is about an 850 world in CO2, and 8.5 is pretty much unrestrained emissions, and that gets you up to 1370 by 2100. I've put at the bottom the website where you can get more information on these. They did achieve what they set out to do. This shows you the carbon emissions from 2000 to 2100, the year 2100 carbon emissions, and most importantly, the atmospheric concentrations. It just is intended to show you that they did span a fuller range. It was a real problem with people trying to look at extreme amounts of emissions, either low or high emissions. You could not do that with the special report on emissions scenarios. A point that I would like to try and get people to understand in particular is when you look at these 4 RCPs, it was decided to take out the projections from the climate models to 2300 instead of just to 2100. And a question that came from the impacts community is really trying to understand what happens if we have high emissions and then in essence kind of a miracle occurs and the emissions go down quite rapidly. If we lose the permafrost, for example, in the Arctic, but you reduce your emissions dramatically, would the permafrost come back? There's a very long list of questions that people would like to ask that could not be explored with the old scenarios. So on the left-hand side, you can see the emissions as they go out, and you can see for, except for 2.6, the green line, that all of the emissions decline unrealistically. They just are being forced to come down very precipitously for the 2 higher representative concentration pathways after 2100. One of the insights from this work is on the right-hand side, which shows you that there's a very deep understanding about the climate change commitment and how slow the atmosphere, how slow temperature has changed with increasing concentrations in the atmosphere. This shows you that that inertia in the system is even stronger on the back end, that as we artificially in these models decline emissions, radiative forcing doesn't change for hundreds of years, that whatever concentration we end up with, the radiative forcing associated with that is going to continue to change the climate for a very long period in the future. So what's different from this process than from the special report on emission scenarios? It's important to understand this is not IPCC, and I've listed a whole range of differences. It's much finer scale. It's a ½ degree by ½ degree on the globe. It's got the short-lived species, very long radiative forcing. While the integrated assessment modelers were working on the emissions that go into the graphs that I just showed you and that are being used right now by the climate modeling community to say what's going to happen with temperature over the century and beyond, the impacts and adaptation community began asking, what assumptions did you make about population and GDP, so that that community could start writing visions of the future that would lead to those levels of population and GDP. This is a slide that was presented about 2 years ago at a meeting here in Washington. On the left, you see population. On the right, you see the GDP. And one of the things that you immediately see is there's no clear pattern between the emissions scenario and either population or GDP. That in essence, you can get to just about any RCP with about any vision of population and GDP. Or said another way, there's lots of different ways you can get to those emissions. This is very different from the approach, the thinking that people had for the special report on emission scenarios. But when you stand back and think about it, it makes sense. You can have a world with a very low population, but burn all the coal in China and have very high emissions. You can have a world with a lot of people, but everybody uses green technology and have very low emissions. And this insight led everybody to step back and think about, given that this is true and that there isn't this strong association between population, GDP, and emissions, then how to develop new scenarios. Over a series of meetings, it was decided to develop scenarios using a matrix. On the left-hand side, you can see the representative concentration pathways, and you can see in the columns there are what are called shared socioeconomic pathways. They're shared because they're shared across the RCPs. The X's are just to indicate that you might not be able to achieve every combination. The real power in this, and the reason that I'm really excited about talking with all of you is this opens opportunities to ask questions that could not be asked before. You've now can start asking questions of if the world is on track for having 6 watts per meter squared in 2100, what if that intersects with a world that's trying to achieve sustainable development versus a world that is much more regional and it has very weak international institutions? What would that mean for impacts? So you can look at how different development pathways would intersect with these different emission pathways. You can also ask questions down the columns. You can say, what if we're in a world that is kind of muddling through, where we do some things well, we take a little bit too long to do them, not too different from how many things are achieved today. And if we're in that kind of world, what if we have a lot, or what if we have a little climate change? So you have power to start thinking very differently about the questions you can ask. You could not do that before because the scenarios were handed to the community as a package. This is a toolkit allowing people to put together scenarios that are relevant to the questions they're being asked. I want to really emphasize, I understand this is complicated. I have the opportunity to speak about this to different audiences, and I understand by now people are thinking it's a lot more complicated than last time, but really emphasize it's worth getting a basic understanding of this toolkit because you can start asking much more interesting and much more policy relevant questions. I have 2 examples up here, both based on malaria, but you can start thinking of a whole range of questions. Thinking about the post-2015 sustainable development. What if that's achieved, but at the same time the world has a lot or a little climate change? There's a lot that can be done with this. How are we developing the shared socioeconomic pathways? After extensive discussions, it was decided to develop them along 2 axes. One is a world that has, or worlds that have increasing challenges to adaptation, and the other axis described worlds with increasing challenges to mitigation. Those are the 2 main policy responses in climate change, so those seem to be the most relevant. Despite all of the advice everyone has given, it was decided that there would be 5 of these because, in fact, policymakers want one in the middle. And what had happened with the SRES, the Special Report on Emission Scenarios, is there had been almost regression to the mean, that they'd been pulled towards the center, so there's one in the middle. These will have names. This is not being led by the IPCC. We're still negotiating those names. In the lower left, you see worlds with low challenges to adaptation and mitigation. These are worlds really working towards sustainable development. In the upper right-hand corner, you see worlds with high challenges to both. These are going to be very regional worlds, very weak international institutions, probably a lot of conflict in them. What do we mean in terms of challenges? These are some examples for challenges to mitigation. These are being developed independent of climate change to the extent we can. We're just talking about what the world might look like. Going back to John's comment on how these are relevant to everyone working in global health, we're looking at how the world could evolve. And so these are some examples of the kinds of challenges you might see in the 4 corners. The one in the middle is kind of a muddling through right now. So a little bit of this, a little bit of that. And these are some examples of challenges to adaptation. Again, the narratives for the shared socioeconomic pathways are fairly short. They're about a couple pages long. They're broad brush visions of the future. The intent is to combine them with an emission pathway to develop an actual scenario, but this gives you a sense of where the world is headed. What's in a shared socioeconomic pathway? There's a narrative, as I mentioned, a couple of pages long. There will be quantification of some elements in there. There's also a lot of qualitative information. We're trying to keep these to the extent possible not influenced by climate change, not having model output, these are considered to be input to considerations for either formal quantitative modeling or expert judgment kind of assessments of what could happen in the future. One of the reasons we were really keen on having this webinar and having people listen in is what are being developed are at the global scale. The possibility then is to take these regionally and sectorally and make them much more specific. There's a sentence or two at most about health in any of these narratives, but it's possible to take these as boundary conditions and look within sectors and regions and ask, what does that mean within a sector or region? As I said, this is a toolkit, and it also, because of the way this is developed, it gives a lot of flexibility. You can have a world working towards sustainable development and still have parts of Central and South America having very high food insecurity. Those are consistent today. Those could be consistent in the future. So it does allow you more diversity instead of what we had before, where there's real consistency from the global to the regional scale. And this means that each sector and region has the responsibility to think about how they would like to use this toolkit to develop scenarios that are relevant for the questions that they are being asked. There is a special issue that is coming. We're waiting still on the review comments to come back. It's in climatic change. The first 4 papers will lay out this framework that I've just talked with you about. Unfortunately, climatic change is published by Springer, and for us to make these open access, each one of us would have to come up with about $3,000. We will let people know when they're available, so you can just email us, because we can send them to you a lot cheaper than that. But these papers will come out later this year, and there'll be 10 other papers on various aspects of the framework. There's a separate special issue in global environmental change that will include a paper that will include the full narratives for the shared socioeconomic pathways, but we also will make those available. So what does this mean for health? It's relatively easy to start thinking about how you could write health narratives. If you look in the lower left-hand corner, a world working towards sustainable development, more children will survive to the age of 5. We'll have a much better control of malnutrition, diarrheal disease, and malaria. It also means that that world would have more chronic disease because you've got more children surviving to the age of 5. There's low challenges to mitigation, which means there would be more controls on various air pollutants. And so the burden of air pollution-related mortality would be expected to go down. In the one in the upper right-hand corner, a regional world where you've got weak international institutions, you would expect the burden of climate-sensitive health outcomes to go up. You would expect it to be much more challenging to control malaria, diarrheal disease, and that there would be a hard time doing so because WHO, PAHO, the other regional offices would not really be able to provide the control that they could do today. The last slide I wanted to show you is there's a group working on this. We have been calling ourselves an ad hoc group for over 2 years and decided at some point we needed a name because ad hoc didn't seem appropriate. We're the International Committee on New Integrated Climate Change Assessment Scenarios. Tim Carter came up with that. We are the Iconics. I've given you the website. I'm co-chairing that with Tom Cram, an integrated assessment modeler. We have 6 working groups that are working on various aspects, and those are listed, and the co-chairs for those are listed. You can get all of this off of that website. We'll be posting information on the website when those papers are available, and we will try to make as much information available on this as we can. With that, thank you very much, and I look forward to the questions later.
Great. Thank you very much, Dr. Ebi. That was a wonderful opening explanation and framing of a very complicated topic. As we do with each of these webinars, we will hold on questions now, but please record your questions. You can send them in to us, and we'll have I'll ensure we have time at the end to address all the questions. But now I'd like to introduce Stéphane Hallegatte. Our second speaker, Dr. Hallegatte, is a senior economist with the World Bank. His work includes macroeconomic dynamics and green growth strategies, urban economics and environmental policies, climate change vulnerability and adaptation, and disaster risk management. Dr. Hallegatte is a lead author with the IPCC for the Special Reports on Risks and Extreme Events, also known as SREX, published in 2011, and for the IPCC's Fifth Assessment Report, which is in process to be published in 2014. He co-led with Marianne Fay of the World Bank the flagship report, Inclusive Green Growth, the Pathway to Sustainable Development. Dr. Hallegatte, we look forward to hearing from you. Thank you.
Thank you very much for the invitation. Can you confirm that you can hear me?
I'm sorry, we can hear you, but the sound quality is not good. So the more you can do to speak clearly into the microphone, the better. Thank you.
Okay, thank you. Please interrupt me if the sound is not good and you need me to repeat something. Please help me to talk a little bit about the process of developing this SSC, and especially what is a long-term view on what we will do with these SSCs. So this shared socioeconomic pathways. The very important thing is that this is not a completely cooked product. It's an ongoing process, and we expect that this will remain an ongoing process for a very long time. And what we would welcome most is an engagement of many different communities in the development of these scenarios and the use of these scenarios to make sure they are most useful and they are.
Dr. Hallegatte, I am sorry to interrupt you. We are having a very, very difficult time understanding you. Is it possible to speak directly into whatever device you are using rather than using the headset microphone?
Well, according to when I tried, the microphone was better. Do you hear me better now?
Speak again, please.
Can you hear me better?
It's better, but I think you'll need to be close to the microphone on the device you're speaking on.
Okay. I will just shut down this video if I have to have my face next to the computer. What I was saying, and I hope you understand me better now, is the development of these scenarios will be an ongoing process for a very long time, that we need many different communities to engage in this development.
Okay. Dr. Hallegatte, again, I apologize for interrupting. I think in order to be able to hear you well, what we're going to do is to stop and go on to the next speaker and have our technicians here call you at your where you are, and that will give us better sound quality. Is that okay with you?
Of course.
Okay. Unfortunately, apologies to all on the call and to Dr. Hallegatte for the technical difficulties we are experiencing, and hopefully we will be able to return to Dr. Hallegatte with excellent sound quality. In the meantime, what I'd like to do is to invite our third speaker, Marc Levy, to join us. Mr. Levy is the Deputy Director of the Center for International Earth Science Information Network, also known as CIESIN, C-I-E-S-I-N, a unit of Columbia University's Earth Institute. He's also an adjunct professor in that university's School of International and Public Affairs. Mr. Levy is a political scientist specializing in the human dimensions of global climate change, global environmental change. His primary research areas are climate security linkages, global environmental governance, and sustainability metrics. He's published in a wide variety of subtopics. He is also currently a lead author of the Intergovernmental Panel for Climate Change's Fifth Assessment, and specifically the chapter on human security. He's the incoming chair of the World Economic Forum's Global Agenda Council on Measuring Sustainability. So, Mr. Levy, we're very pleased to have you, and please begin.
Are you able to hear me now?
We hear you now. Thank you.
Okay, and you can see my title slide. Is that correct?
I'm sorry. Again, the sound quality is not great. If there's a way to speak close to the microphone, that will be better.
Okay, I'm speaking as close as I can. Is this better?
That is, yes, that's somewhat better. Yes, that's somewhat better. Anything we can do on our end on the volume, that would be very good.
I wonder if I should simply use the telephone to call in. I see there's an option for me to do that.
I think we can hear you okay. Why don't you proceed?
Okay. So I'm going to focus on 3 questions which we are trying to deal with in the course of implementing one aspect of the plan that Chris introduced to you. The community that I am representing here is the community trying to help develop quantitative indicators to be used in scenario analysis of the impacts of climate change, to understand the patterns of vulnerability that will unfold in the future. I've decided to focus on 3 questions which we are wrestling with that can give you a sense of what has to happen in order to do better at characterizing future vulnerability of climate change. These are the questions of what indicators need to be added to our scenarios, how we handle the question of what level of variation in the indicators is appropriate, and how to handle the question of the dependencies among the elements of an indicator set within a scenario. So on the first question, as Chris already mentioned, the existing family of scenarios that we have inherited do not do a good job at specifying the kinds of conditions that will shape the degree to which future societies are vulnerable to climate change. So if we imagine a very simple model as a heuristic in which we have physical aspects of climate change, such as temperature and precipitation, leading to impacts that are relevant to human society, changes in food security, health outcomes, and so on. We know that there's not a one-to-one relationship between those 2 things. We cannot derive human impacts purely from physical drivers. We need to know the socioeconomic conditions that mediate between those things. And so the simple decision rule for us is to identify the most important basket of measurable socioeconomic parameters that will play the biggest role in discriminating between areas of high vulnerability and low vulnerability, given a common set of physical stresses. So as one part of an exercise to narrow down the set of highest priority socioeconomic variables, a couple of members of our community carried out an expert survey and yielded a high priority list that you see on the slide in front of you. This is a list that has been deemed most important to understand climate impacts in general. If somebody is doing a more specific, focused scenario exercise, there may be additional elements that would need to come in. But what's depressing, what's challenging, is that very few of these socioeconomic variables were specified to any satisfactory manner in the existing family of climate scenarios. So we had a lot of catching up to do in order to provide something useful. In practice, over the last 15 years, what people have done when they've wanted to ask questions about climate impacts, not just the physical climate change, they have been forced to resort to assumptions that all of these things will remain constant into the future. And that's clearly not a very satisfying way to do analysis. So what we are doing is we have processes underway to populate quantitative databases over time and space with most of those additional socioeconomic indicators. Some of them lend themselves more easily to quantification than others. For example, the innovation capacity is proving very difficult. That may be an example of an indicator which is treated purely in narrative form. And so the families of different shared socioeconomic pathways will have storylines that characterize innovation capacity, but we may not be able to have quantitative indicators. So I'd like to shift now to my second big question, how to get the variance right. If we look at what we've done in the past as a community, we've tended to degrade the specification of variance over time and space. So over time, we tend to project linear or at least monotonically increasing trends. There's none of the intertemporal variability that we see in the real world. And over space, we tend to dampen the variation that we see in the real world from country to country, region to region, city to city. And we end up with socioeconomic scenarios in which those regional differences are washed out. So our message with the community that cares about human impacts from climate change is unwilling to live with this condition. And so rather than being forced to accept very low levels of variance over time and space, we want to evaluate the question explicitly. What kind of spatial and temporal variability is appropriate to the questions we're asking? So as we go through the exercise of generating quantitative indicators, we're doing business rather differently than the community carried out the task for the special report on emission scenarios. The slide in front of you now is a summary of the implicit variation across countries in per capita income. The summary statistic is a mean normalized variance measure. What you see in the blue line at the beginning of the time series is the historical observed data. And then the multiple lines that follow that are the implicit measures of the same indicator in the special report on an emission scenario quantitative indicators. So clearly, this sort of portrayal of how income distribution might look in the future is unacceptable to communities wanting to understand how human societies will respond to new stresses. So for example, many of the health researchers looking at the likely impacts of climate change on health in poor regions such as Africa in the last 15 years simply rejected these scenarios as unusable because they embedded an artificial, unrealistic assumption, a very rapid growth in per capita income that if they had used them would have led to spurious, even dangerous results. So what we're doing now is trying to be more sensitive to the variance that matters. It's still quite difficult. So this is a slide that shows a different metric of the same phenomenon, inequality of per capita income across countries. What you see now is the observed data. And then if you ask a group of mainstream economic modelers to project future national incomes, what you get is a set of scenarios like this. This is from the Organization for Economic Cooperation and Development. And even when asked to generate future scenarios of income that maximize the spread across these assumptions, one of which is an assumption that says inequality will grow, instead you get all of these models showing a rapid reduction of inequality across countries. And this is one of the lessons we are learning, that in order to generate useful quantitative projections of these socioeconomic parameters, it may be the case that the best models are the worst projectors. In this case, these are the results of models that are considered quite good for what they do. They use economic theory and data to project future income. But they do so in a manner that yields results that are not fit for purpose at all. Other groups are trying to tweak the methods for generating projections. So what you see here is, for the same scenarios, the same summary indicator as developed by the International Institute for Applied Systems Analysis. And here you see the right kind of spread. You at least have a continuation in one scenario of high levels of inequality. And so if you want to examine the impact of climate change on societies in a world in which you think income inequality across countries will remain high, you have a tool with which to do it. I'm now going to conclude with my third big question, which is how to get the dependencies across the quantitative elements in a scenario specified correctly. And here what we've learned from a review of past practice is that there's a very difficult tension. On the one hand, we want the quantitative relationship among the elements to be to represent as accurately as possible the state of knowledge about how these things fit together. So for example, if we know that as incomes rise, countries tend to become more urbanized, then we would want the collection of indicators in a scenario to reflect that. If the rate of urbanization was unrooted to the rate of income growth, it may make it difficult to come up with useful analysis of how societies will become more or less vulnerable. So that leads us to want to make those relationships as tightly correlated as possible with respect to the existing scientific knowledge. But the danger is that if we do that too much, we will become blinded to the possibility that new vulnerabilities may emerge as a result of exceptions or anomalies or discontinuities in those relationships. So, for example, if we just simply assumed that social infrastructure will improve as incomes go up, we may miss the chance to discover a critical vulnerability that would come from a society that is becoming wealthier in terms of income, but underdeveloped with respect to infrastructure. So if we assume too much, we may miss the ability to do the precise job that we're supposed to be doing, which is uncovering critical vulnerabilities. There's no simple cookbook answer for how to handle this. The best practice that we recommend is to make these trade-offs explicitly and transparently, and to do them in a way that if there's an implication for your ability to understand risk, you're upfront about what that implication is. In general, we find that scenario exercises at the local level tend to do a better job at this. They're more sensitive to the many ways that different factors can interact to generate risk. And so they're very worried about getting this right. As you move to the global level, it becomes more difficult to do this, and we see more mistakes being made. So the summary in terms of how we're doing to meet this new need to have quantitative indicators consistent with these new narratives that can be used to understand the risks to human societies from climate change is that our baseline condition is pretty bad. We do not have quantitative scenarios that reflect the phenomena that matter the most, but we're working hard to bring them in. And over the next few years, we expect to have, high quality, usable, quantitative indicators on income, spatial population, inequality, governance, and health, for example. In terms of dealing with variance, we're experiencing a new game. Historically, we've largely ignored this problem. We're paying more attention to it. We're making baby step progress, but we have a long way to go. And on representing dependencies, we've got a lot of good examples and existence proofs at the local scale where communities are carrying out scenario exercises that show, artful, intelligent ways to handle these tensions. We're not doing it very well globally, and we need new experiments on how to do better at blending the local and the global. Getting these dependencies specified correctly is especially important for the kind of issue that's at stake in the conversation we're having today, bringing together the climate community and the health community. For many climate impact questions, health is a background condition that will shape, for example, the relationship between climate stress and poverty. If you have healthy populations, you'll have one type of reaction. If you have populations with diminished health, you'll have a different reaction. The same thing is true in the mirror image. If climate change leads to more immiserated populations, their health responses to climate stress will be different than if they were able to respond to climate change with fewer health consequences. So getting these interactions explicit and transparent and understandable is especially important now more than ever. Thank you.
Thank you very much, Mark. That was an excellent presentation and really helps to bring out some of the specific issues that we have to deal with as we try to address this issue of scenario development and developing useful policy-relevant models for future. We are going to, again, I know that presentation has me thinking up a lot of questions. I hope it has our participants. bubbling up a lot of questions in their own minds and sending them in, but we are going to hold on addressing those questions until we hear from Dr. Hallegatte, who I hope we have now on the phone line, and we can hear from now. So Dr. Hallegatte, Senior Economist with the World Bank, please go ahead.
Okay, I hope you hear me.
That is so
much better. Great. So the point I wanted to make is the fact that this process of developing scenarios for climate change analysis will not be a process that will end in the near future. It will be an ongoing development, and we hope that this process will continue for a long time with a circle of improvement in the scenarios we have. And in this development, we hope that many communities will get engaged and will help develop the scenario from a supply point of view by just like helping defining the scenarios, but also by using them and getting lessons from the use of these scenarios. So just to give you an idea, we have this development of new scenarios right now, these shared socioeconomic pathways, and what we will need to look at is a set of three questions. The first question is the issue of scale. As Marc mentioned, these are global scenarios, and many of the things we're interested in are at local scale. So we will need the development of local scenarios based on these global ones, and we will need these local scenarios to be used for analyzing actual policy decisions. The second question is a question of content. Again, Marc touched on the issue. What is the content of the scenarios that is needed to make them appropriate to analyze various decisions? And the third question is a question of relevance. What scenarios do we need to think about one question, and what are the differences across scenario that we need to look at? So I'll just get into these three things, and in this idea of a revising process of the scenarios, we hope that by looking at these three issues, we can get inputs for a new generation of scenarios in a few years. So let me start with the scale issues. Most decisions will require local scale scenarios, and the global ones, even if they are very well designed, cannot answer all the needs. To give you an example, if you're looking at the health impact of local pollution, it will depend a lot on global choices that these scenarios will describe, oil price, availability of electric cars and other things, but also on local choices. So only a combination of global and local scenarios will help you analyze this question. Same thing for natural disasters. It will depend on many things at the global scale, like foreign aid, for instance, but also on many local choices. So we will need to complement global scenarios with local ones. And in doing that, it's really important to understand the global scenarios as boundary conditions, but there is no deterministic link between what's going on at the global scale and what's going on at the local scale. For some questions like governance, we can imagine very different things happening. So if the world is having a great improvement in governance, it doesn't mean that all regions will have the same trend, and we can have worsening governance in some places. So for governance, local scenarios will be very weakly connected to the global ones. But if we're looking at technologies, it's very different. It's very unlikely that electric cars are available in one region and not globally, because most of this market is not global. So depending on the issue we're looking at, the local and global scenarios will be very closely connected on that. What we're hoping we will have in the next years is, based on these global scenarios that we are developing right now, many people will downscale these scenarios at local scale. So just here it's a picture of a local scenario for the development of the city of Paris in France. So many people will have to do that, take the global one and look at what it means at the local scale. And what we hope we will be able to do at a later stage is try to aggregate many local scenarios to get an idea about whether the global scenarios that we picked were good choices or if they don't make sense, because when we don't scale them at local scale, we find impossibilities or inconsistencies. The second question is the question of the contents of the scenarios. So Marc discussed that. If we look at the health issues, it's very clear that the previous generation of scenarios was lacking a lot of the information needed. Very little on inequality within countries, for instance, nothing on governance and the development of healthcare insurance, for instance. The new generation will make progress in that direction, but it's very unlikely that the supply side of the scenarios will be able to provide the health community what it needs to do its work. So we will need an engagement of the users to identify what is required in these scenarios and to help develop the corresponding quantitative or qualitative information for this new content. And this is really a great opportunity for these scenarios not to be used only for climate change analysis. It could be used for any analysis related to very long-term trends. And it's also an opportunity for the climate change community to introduce more on health than what we have today. The last issue is the question of relevance. And the problem here is that we clearly have an infinite number of possible futures. And we know that we will not be able to predict the future, so we will have to consider many, many different possibilities. But for practical reasons, we will have only a small set of scenarios. So in this generation, we'll have 5 shared socioeconomic pathways, and we need them to be able to be used for many, many research questions and for many, many policy analysis. So the choice of these 5 scenarios will be very difficult. Just to illustrate this, I want to show the result of one global economic model, and looking at 2 variables. On the x-axis is the income per capita of the 20% poorest in the world, and the y-axis is the baseline emission of greenhouse gases at the global scale. And each dot is one possible scenario when you change technologies, demographics, economic development, and so on. So we'll have a lot of these, and out of this set, we will need to pick a few scenarios. So one way of doing that is just to identify some big spaces, some futures that look like the same, and that are the 5 boxes that are represented here that we use to select SSPs. But we know that for the same level of capacity or challenge to mitigation or challenge to adaptation, a lot of different features would fit, and the choice will be arbitrary. We know that, and we need to think very hard about how to do this. And what's really important is when Chris said that these scenarios will be organized according to these 2 axes, the challenge to adaptation and challenge to mitigation, we don't have very good indicators for the challenge to adaptation and challenge to mitigation. And the 2 figures you see here are just the same scenarios, but organized using different indicators for the challenge to mitigation and adaptation. On the top left-hand side, the challenge to adaptation is the GDP of the poorest in the world, assumed to be a good indicator of their ability to adapt. And the challenge to mitigation is the emission in baseline. Perfectly relevant indicators, but they are very, very narrow view of what could be the challenges to adaptation and mitigation. If we use a different set of indicators, for instance, the share of agriculture in GDP as a challenge to adaptation, and the GDP cost, so the loss in GDP to reach 1 climate target for the challenge to mitigation, we find completely different scenarios. So it will be very difficult to find 5 scenarios that can fit all needs. And ideally, what we would like to have is a different set of scenarios for each research question and each policy analysis. So one way of doing that might be to, in addition to these 5 SSPs, have a data set with many, many scenarios that can be used for different purposes. So for instance, working on waterborne illnesses, having scenarios with different oil prices might be useless. What we need is scenarios with very different use of groundwater and very different
Dr. Hallegatte, I'm not exactly sure why. Okay, everybody listening in, we're going to try to reconnect with Dr. Hallegatte. We'll give that a few minutes. If we don't succeed quickly, maybe we can start to entertain some questions for Dr. Ebi and for Marc Levy, who I hope is still with us. Okay, Dr. Hallegatte, I think we have our connection restored, and we'll ask you to resume. Sorry for the interruption, and just one quick request. Our translator has asked, the sound quality has been very good, but if you could speak a little more slowly for the sake of our translator, that would be great. Are you there?
I'm here.
Oh, okay,
I'm sorry, I didn't know that it was translated.
No worries.
So what I was saying before the interruption was that for different issues like working on waterborne illnesses or on air pollution in cities, the scenarios we will need to make an analysis of the problem will be very different. For waterborne illnesses, you want scenarios that are very different in terms of land use and agriculture practices, for instance. For local air pollution in cities, it's more the question of oil prices and technologies. So it's difficult to select 5 SSPs, that 5 scenarios that will meet all these needs. So over the long term, it's very likely that in addition to the 5 main scenarios that we have been talking about, we will need something broader with many, many scenarios and a way to select the most relevant scenario for a given question. And to do that, we will need a lot of engagement of the users of these type of scenarios. And for instance, looking at health issues, what we need to know is whether what is most important is to have scenarios with big differences in demographics. For instance, is aging the most important issue, or differences in terms of economic conditions, could be in terms of income, job stability, or it could be differences in access to services like sanitation, drinking water, and other infrastructure, and how these different things need to be correlated because we can't have many scenarios spreading all the space. So doing this will be a common work by people producing scenarios like the integrated modelers and the people using scenarios to analyze different policy questions. So I will conclude here by just stressing again the fact that for these 3 big issues, the question of how global scale and local scale scenarios can interact and how we can make sure what we do is consistent, the question of the content of the scenarios and the type of variables that you need to find in scenarios, and the question of how to select a few scenarios that can be used for policy analysis among the thousands of different scenarios that are possible and produced by modelers for these three big issues, there is a great opportunity for various communities to engage within this process and to make sure it's not only a process driven by the supply of scenarios, so not a process driven only by the producers of scenarios, but also a process that meets the needs of the users. And for that, we need more engagement. And today, it's a process which is still mainly moved forward by the producers of scenario. And I think it's great that we have such a seminar because it might help to get the users more engaged. Sorry again for the technical issue and for speaking too fast. I'm traveling and it has been complicated, but I hope the main messages went through. Thanks again.
Thank you very much, Dr. Hallegatte. And our apologies for the technical problems. Your presentation was excellent and very clear. So we will now move on to question and answer. And I will take the prerogative, since I don't have a question in front of me from the audience yet, to ask the first question. And that question is in Dr. Hallegatte's presentation, and to some extent in Mr. Levy's, there was a recognition that there are many possible scenarios, that there are so many different variables that all need to be considered at the same time, and that in settling in on any one or set of five or a limited number of scenarios, there's a certain amount of arbitrariness, and that's not a word that I've added to it. It was a word that I heard. At the same time, we have this issue with all scientific work on climate change, and especially the IPCC process, of an effort to make this as unassailable, as solidly based, and as accepted by the broad scientific community as possible. To have transparency, to allow anybody from the outside world to see the decisions that were made and to be able to support them. So my question is, given the challenge here in this kind of arena where we are dealing with a certain amount of expert judgment and subjectiveness, what are the intended mechanisms within the IPCC or within the Iconics committee to address the governance of the selection process? What are the mechanisms in place to try to gain acceptance of the ultimate products of the process?
It's okay if I go first? Marc, Stéphane?
Chris, go ahead.
Thank you, John. That's a really good question. So first of all, one of the challenges has been, as I said, this is being led by the scientific community, which means nobody's in charge. And it is an unfunded mandate, basically. So we don't have core funding to make this move forward. And it is one of the challenges with not having this being led by anybody in particular. There's been real effort throughout the process. The IPCC has facilitated a couple meetings. Every time the IPCC helps facilitate a meeting, they require that at least 40% of the participants be from developing countries, which has been critical to ensuring that we've had input throughout the process from scientists throughout the developing countries. It's been a real challenge to keep people engaged without any funding. So one option going forward is there's a new process called Future Earth. And all of us are, in various ways, talking to people involved in Future Earth to see if this is one of the core activities that Future Earth would take on. Because we do recognize that it is important to have something like this, to have an organization, to be a part of a bigger organization that can help ensure that you do have a range of voices. And we've always wanted to have a range of voices engaged. But without having the core funding that you would get from something like that, it's been very challenging to do so.
Thank you. That's a good answer. And could you just explain a little bit about what Future Earth is and what it's replacing?
I wish I could explain this well.
15 seconds.
Future Earth is replacing a whole series of organizations, the International Human Dimensions Program, IGVP, which I don't remember, International Geosphere, Biosphere Program, a series of international programs that have focused on various aspects of what we need to understand about how the future will evolve and how it will interact with global environmental change. It will be replaced by this group. 2 weeks ago, the executive director of the scientific community was named. It's Dr. Mark Stafford-Smith in Australia. They have named their committee. They are looking at core issues that they will take on, and we do hope this will be one of them.
Thank you. Mark or Stéphane, did you want to add anything to that?
This is Mark. I had a couple of thoughts. I think you've hit on a key challenge, and it may be that this is a circle that just simply cannot be squared, but we are going to try anyway. I think there's two things in addition to what Chris mentioned that are relevant. The first is the simple act of generating these 5 shared socioeconomic pathways, each of which will be populated with quantitative indicators, means that we will have the possibility of anybody doing scenario analysis on climate impacts to use a set of 5 reference scenarios, which will make their results comparable in a meaningful way. So if you pick up a new study on, say, the likely health impacts of climate change in a given region, at present it's really hard to tell how that study differs from other studies if it's a function of the modeling assumptions, the data inputs, the climate model runs that they used, the projections of socioeconomic conditions they used. If we can get a set of more or less fixed reference scenarios and build up a community of practice in which it's expected that if you publish, you benchmark against those, it'll be much easier for us to compare results. The second is we know that nobody's going to be happy using only those reference scenarios. They're going to tinker with them as they should. They need to, for the reasons that Stéphane mentioned. So what we need in addition to the reference scenarios is a set of methods for documenting the deviations from them in as simple and transparent a manner as possible so that consumers of the results of those exercises can understand how they differ on the scenario side, on the assumptions, so we can start making sense of the differences in the results that people have come up with. I think those are achievable outcomes.
Thank you very much. And Stéphane, anything to add?
Just a quick compliment to say that we're trying to achieve really a lot with these scenarios, and especially as Marc mentioned, we want to be able to aggregate many different studies of different things and to do this aggregation to get a picture of climate risks. We need everybody to use the same scenarios. But in the same time, we want tailor-made scenarios for some questions. So we have to acknowledge that these 5 scenarios will not be able to meet all the needs and probably have them complemented with other things. And we can see right now that in addition to the 5 main scenarios, we'll have a lot of different scenarios built for different uses. So it's very, very important to stress that this doesn't mean that these 5 scenarios will be all we have. We will have other things. It's just one piece of the puzzle. And because you asked the question about how we select them, and to reinforce what Chris said, we really need an engagement, and it has been difficult right now. And the engagement is quite natural for the producers of these scenarios, not so much for the users. So how to mobilize the user communities is a big challenge right now.
Wonderful. Thank you very much. We have one question from the room, and if you'd identify yourself and ask the question.
Yes, Carlos Santos Burgoa from the Pan American Health Organization. I have to confess that this is one of the most exciting webinars and seminars that we have been in this round of webinars. So I thank all the speakers. This is an innovation collaborative, and I think this is an innovation collaborative on health and sustainable development. And I think the seed of innovation is here, and I think we made it. We have it here. I have a comment on the health dimension on these models. The assumption of, let's say, the quality of the population that we are including into these models. It's true that there are demographics of that, but the health condition of the people who are included, if they are sick, and chronic sickness is now really the norm, and this is happening all the time, and that is something that I think we have to, when we build the pool of people who are put into the models as an input, I think that would be something important to consider. But other assumptions that we have to consider is the assumption on access to universal health coverage, and that is, there is now a major driver on that. The technological change that is going on in medical care is extremely impressive. And assumptions on the risks that make people sick and how we manage to modify those risks. I think those are considerations that we have to include into these models. Thinking about this during the seminar, I would say this by itself, for the health community, for the public health community, these are extremely important questions for general policy making and for the design of what's going to happen in the future. If we add the climate variables, this really makes a Manhattan project of whatever we can think about.
Quick comments?
That's excellent. And this is one of the reasons we were excited about doing the webinar. These offer an opportunity and a challenge for the health sector. There is a real opportunity to take these and make these useful. The challenge is, how much can we quantify in the health sector going forward? The health sector has not been very good on developing projections, but can we use these different socioeconomic pathways to say, what do we say will be the burden of childhood mortality in 2050? What will be the burden of chronic disease? And so there is an opportunity for the health sector to really engage and define what's most important for us. It's also an opportunity to engage. Agriculture is developing its own set of scenarios for use in their sector. Can we work with the people in agriculture to figure out what's going to happen with food security? There's really important questions, and how we go forward. Because this is an unfunded mandate, one of my big hopes is that Tahoe, WHO headquarters, and the other regional offices will start taking this up to start thinking about what they will need out of these, what information can be provided, and can we develop some kind of collaborative project to write out narratives that will be useful for you here, useful for the other regions, and then push the research community to fill in the kind of information that we need to quantitate.
Thank you. I'm going to, since we're running out of time, we have a question from our listeners. And again, I'm going to take some prerogative. I'm going to ask the question as it's been translated for me, but then I'm going to add an extra nuance to it. So the question that comes in is, how should the social determinants of health be approached around or within the climate change scenarios? And I'm going to add a little piece to that, which is to what extent are the social determinants of health something that gets assumed in the scenarios versus something that is an output of the models themselves, and how do you strike that balance? And of course, there are many different social determinants of health, and some will probably be one or the other. But if you could just address that issue of also assumption of what they will be or imagination of what they will be versus the modeling of those social determinants.
When thinking about the shared socioeconomic pathways, what goes in there are variables that will be important for using for projections of impacts or for looking at adaptation and mitigation policies. And so as input, you need quantification of a range of the social determinants of health. It is, I can certainly make my own definition of what goes in. I do believe very strongly this should be a collaborative effort because I have my own individual opinion. There's other opinions that are of equal value. And what does the sector say is important to include in these, so we make sure that we describe them, we quantitate them out at least to 2050, longer would be much better, to help better inform the modeling work that is going on to say what the impacts of climate change might be. It's important that, as both Stéphane and Marc made very clear, you don't want to assume temperature change on today's society and say that's going to be the impacts in 2050 or 2100. We have to think much more deeply about how we describe worlds in the future, what the critical components would be, and do it in a way that we can have broad buy-in across all the relevant individuals who should be engaged in this.
Thank you very much. Marc and Stéphane, did you have anything to add to that?
Yeah, maybe a quick point on the fact that everything we have in these scenarios is an input and an output. Even GDP is something that will be modified by climate change impact. So in a sense, it will be an output of the analysis. And this is why this process is not a one-shot thing, because basically we will start with an input, work on the impact of climate change, and then be able to revise our scenarios in view of the results of this analysis. And for health, it will be something really important because many of the people working on climate change impact will want information on health as an input. And in parallel, the health community will work on this health impact as an output. And over time, we want this work to, these people to work together and to revise in a continuous way the scenarios that everybody's using to make sure they are better and better and more consistent.
Great, thank you very much. I think we are just about out of time. We had one more question, and I'm again going to take the prerogative to raise this question and then answer it myself in closing. That's a lot of prerogative, I know, but given the time, I think that's the most efficient. And the question that has come in is basically saying, do we have models that can tell us what the health impacts would be of major kinds of climate mitigation initiatives, policies, or movements, such as if the United States went completely from gasoline vehicles to hydrogen fuel or batteries, or if all of the power plants in the United States or China were switched from coal to nuclear? Do we have a way, the question is, do we have a way to understand the impacts? And the answer is those are exactly the kinds of questions that these integrated assessment models are being created to explore. And our topic today has been, how do we provide the scientists who are making those integrated assessment models with the best information about what the world of global health will look like in the future so that they can give us the most accurate assessment of what those impacts will be of exactly those kinds of climate mitigation and adaptation measures. So thank you for that question. So Thank you for that question. With that, I would like to thank our three speakers for excellent presentations. This has been a really outstanding discussion of what is a very complicated issue. Thank you to everybody for hanging through the complexity and the technical difficulties that we had. And again, I invite all participants to join us for our next webinar. It will be taking place at the same time on July 25th. And I look forward to continuing all of our discussions then. So thank you very much, and good afternoon, good evening.